Hi, everybody. We are going to get started. I am Justin. I'm the managing director with Inova Recovery. Inova Recovery is a center leader in trauma and mental health education. We offer outpatient, intensive outpatient groups, and residential level of care. Currently, we offer IOP for women, men, teens, and are just launching our LGBTQ group next week. So we're very excited about that. We also just opened last year a trauma center for women. It's a residential down here in San Antonio, Texas. And as you are joining us today, you are part of our free rotating monthly webinar series providing mental health and the public just knowledge about trauma. One of the things that we have seen throughout our time is how trauma is experienced by almost every person on a variety of scales and how little it is talked about. We're super excited to have Ms. Rebekka with us today. She's one of our phenomenal clinicians that we have here. Rebekka actually graduated with her bachelor's degree in communications from Michigan State and then went on to get her master's in human services, marriage and family, and a master's in professional counseling from Liberty University. She has an amazing heart in dealing with childhood trauma, sexual assault, depression, anxiety, and of course, trauma recovery. Her personal experiences have encouraged her desire to work with children, adolescents, and adults in individual and group therapy, knowing firsthand the importance of restoration. She believes that insight and acceptance are an integral component to true healing and positive change. She is also a Marine Corps veteran and a proud mother of 3 amazing boys. So without further ado, I will have Rebekka begin her CU.
Thank you, Justin. So today, good afternoon, everyone. Thank you so much for being here. Today, we are going to be talking about cultivating cultural competence in counseling. And my goal is to shed some light on culture itself and explore how the historical context relates to counseling and providing quality care for our clients. So I would like for you to be aware that you may see some images throughout the presentation that may be uncomfortable for you. I do ask that you hold any questions for the end, and we will have some time set aside for question and answers, okay? So we start by looking at culture itself. Okay, culture helps us to make meaning of the world around us. It shapes our thoughts, our emotions, our behaviors. But how much does culture really matter? If we look at Webster's dictionary, it's going to define culture in a different way. It's going to say that, culture is the customary beliefs and social forms, material traits, or racial, religious, of social groups. And these things will be shared amongst people at a different place and time, right? So for right now, if you have the little chat feature, I believe that we have it at the bottom. What I'd like for you to do is just take a moment and write into the little Q&A area, write one word that would describe you. Whatever that looks like for you, just one word that you feel like would describe you. And go ahead and put it in that chat area. Difficult to identity. It's a wide variety of things, okay? If we look at cultural identity in the form of an umbrella, there are a lot of facets of what we consider to be included in culture, okay? Our cultural identity is very complex, and the surprising thing is that it changes over time. So on here, you can see we have religion and customs, even people's manners, their values, their belief systems, right? It's important to remember that when we're talking about cultural identity, these are integrated patterns of beliefs and behaviors that are often transmitted throughout generations. And so if we look at our children, sometimes these things are being enforced, and the children are actually not necessarily having a choice, right? And so when we're looking at cultural identity, that is something that's just integral to remember, that these different things, arts, language, food, they are being passed on throughout generations. Our cultural identity is learned. Okay. And that's something that I hope that you will be able to take away from today. When we look at cultural humility, this actual term was, and this, when, doing my research, I found this to be very interesting. This term, cultural humility, didn't even come about until 1998. And so if we think about it in a time frame, that wasn't too long ago, right? But all of a sudden, some professionals came up with this term, cultural humility. And originally it was to describe culture as a tool to educate physicians, to work with culturally, ethnic, and racially diverse populations. Okay, so that's how it originally came about. And as you can see, the National Institute of Health defines cultural humility as a lifelong process of self-reflection and self-critique, whereby the individual not only learns about another's culture, but one starts with an examination of his or her own beliefs and cultural identities. Okay, so when we're looking at cultural identity, it is not enough to think about one's own values, beliefs, and social position within the context of the present moment. However, you want to practice cultural humility all the time. This is what we live. A person must always be aware of and sensitive to the historic realities, like legacies of violence and oppression against certain groups of people, especially when we are working in the human services profession. Cultural competency is going to give you a different outlook, okay? And that's what we're talking about here today. Cultural competency is the ability to understand, appreciate, and interact with people from other cultures or belief systems that are different from your own. However, it is this journey that requires a commitment to self-reflection, to learning about other cultures, and to skill building. So when we're doing a self-reflection, it can be uncomfortable at times. However, if you're in a helping profession, then that discomfort is something that your clients may feel all the time. And so it's important to consider how others are feeling in those moments in which you may be feeling uncomfortable, to bring you to a deeper understanding of how they may feel. And this can help to grow in the therapeutic relationship, because now your client understands and knows that you are taking into consideration everything about them. It's important to think beyond culture when we are talking about competent treatment in the helping professions. So if we take a look at cultural competency versus cultural humility, they tie together, right? So these things go hand in hand. Cultural competency includes that commitment we just talked about to practicing cultural humility. Cultural humility is going to acknowledge that even with training in cultural competency, we always have more to learn. And so that's where I go back to, this is something we live. We don't just learn it, we live it, because it has to be practiced every day. And you have to be aware of the way in which you are treating others and considering others with your own bias, okay? Both of these are essential to enhancing the quality of care when we are talking about a healthcare setting. This quote, you may have heard it and seen before, and I absolutely love this quote because it truly puts things into perspective of our own beliefs, and often our inability to see things clearly. Okay, we don't see things as they are. We see things as we are. And if we're not self-aware of how we believe and what our worldview looks like, then how are we going to serve other individuals? Okay. So we want to take a look at the mental health disparities when we are talking about culture. All right, we're talking about racism, discrimination, violence, poverty, all of these things, and this was provided by the US Surgeon General, it indicates that members of ethnic and racial minority groups in the US, they face a social and economic environment of inequality. And that includes greater exposure to racism, discrimination, violence, and poverty. And all of these things take a toll on mental health. And we're talking about generational mental health, okay? Because again, these things get passed down, like we discussed earlier. Most racial ethnic minority groups overall have similar, or in some cases, fewer mental disorders than Caucasian Americans. Okay. However, the consequences of mental illness in minorities is going to maybe long lasting. Okay. And this is due to these disparities that surround these particular communities. Okay. And so that's where the difference comes in. When we talk about these disparities for these communities, it is like hitting a brick wall. We are talking about less access to quality care, language and communication barriers that may take place, negative past experiences in which are going to make individuals apprehensive to even go to counseling in the first place, because that one time, or even a doctor, physicians, because that one time that they went, they were treated a certain way and now they don't want to come back. Okay. And just lower quality of care. So we not only have less access to care, but we have a lower quality of care. And so it literally is like hitting a brick wall. Okay. For members of ethnic and racial minority groups, these health disparities are pivotal in their livelihoods, okay, and in the way that they see the world. They shape their worldview, okay. For African Americans, you know, if we consider the past, you know, African Americans have been marginalized and discriminated against for centuries. They carry this pain throughout generations, okay. And so, you know, we have an image here of things that took place during the transatlantic slave trade and the recent killing of George Floyd and some of the marches, you know, and someone that is African American that decides to come to counseling is making a very brave commitment to seek mental health care. And they are often met with racial microaggressions in the therapeutic settings. And this can immediately create a weaker bond. I can recall a time when I first started practicing and I was in my first internship, and my name's Rebekka, obviously, and I have a certain dialect, and I had a family come in. I was going to be working with their child, and immediately the 7-year-old boy says, "I didn't know you were Black." The mom didn't know what to say, right? And I just smiled and I said, "Well, that's okay. I'm Miss Rebekka." And I proceeded to bring them in for our session. Okay, so sometimes this can be twofold. All right, your client may have a certain expectation of whom they're coming to visit, and they may see things differently. And then, two, taking into the considerations of where your client may be coming from, the experience that they may have had in another setting. Another short story I had when we're talking about some of the civil liberties that have taken place, these things have to be considered. I had a 16-year-old child that came in with her mother one day, and on their way to the office, they were pulled over by the police. This child was terrified when she came into session. She was crying. And the whole session was spent processing that incident because of the encounter with the police. And it was just a warning. Mom was going a little bit too fast. However, the fear that was placed, that'll be lasting. Okay. So these are definitely things that you want to consider when you are working with people of different nationalities than yourself. When we are talking about American and Native Indians, in addition to the racism that these groups often have, American Indian communities are mostly living outside of reservations, okay? And so when we talk about access to healthcare, it's limited. because most services are going to be in the hospitals, the clinics, they're going with the Indian Health Service are going to be on a reservation. And so if you have some American and Native Indians that are living outside in the community, then these services are not as easily accessible. And those are things that we don't tend to consider, right? When we're looking at people that are bilingual patients, they are often evaluated in English when Spanish may be their primary language. And so some of the information that is provided can be misconstrued because English is not their primary language. And so they may not be understanding you, and there may be this miscommunication that takes place, in addition to the racism that they have occurred, the racism and classism that they occur as well. And so again, these are all just different things to consider when we are talking about cultural competence, because it is as a whole. Looking at Asian Americans, again, especially during this time, the sign that she has says, my ethnicity is not a virus, okay? Nearly 1 out of 2, literally 1 out of 2 Asian Americans will have difficulty accessing mental health treatment. And this is because many of them, English is not their first language, and they cannot find the services to meet their needs. Okay, and so again, we have these disparities that are targeting all of these different minority populations. When we look at the LGBTQIA, and I did identify all of this for you on the slide in terms of what these terms mean, we are now dealing with an entirely different group of people. And many people within this population have reported that they have faced cases of providers denying care, of using harsh language towards them, or blaming the patient's sexual orientation or gender identity as the cause for their mental illness. Working with teens, and I just have a little picture of the teens on here, I can tell you that this is already a difficult time in their lives. They are trying to understand the world around them. They are trying to identify themselves, okay? And if they are identifying in a different way, then they too are sometimes faced with these disparities, and it makes it worse for them. That's why we see an increase in teen suicides and suicides in general with this population, mostly because of that acceptance factor that is missing from our quality of care. So then I'd like to move on to how all of this intersects. All right, so we see here this whole intersection when we are talking about racism, disability, sexism, classism, all of these things. At some point, they are going to intersect. And so what does that do to the way you are treating your client? All right, when we're looking at these, they're overlapping identities of privilege and oppression at the societal level, all right? It's important that these things are considered when working with clients that may deal with more than one form of discrimination or disadvantages. It's not a cookie cutter industry. We're not cookie cutter people, and everyone is so amazing and unique and beautiful. But a lot of times we will have these moments of intersectionality in which they overlap. So the more that we understand how these social identities intersect and influence the life experiences of the clients, the better that the therapeutic relationship can be. So when we are discussing exploring treatment, all right, if we tailor a treatment based only on someone's ethnicity without understanding and taking into account their gender, are we providing culturally appropriate care? How about if we tailor a treatment for someone's sexual orientation without understanding and taking into account their socioeconomic status? How can you be better able to respect and respond to your client's values and needs in treatment if you do not have a thorough assessment that has taken place and you are not taking all of who they are into consideration? Even when culture is not a conscious consideration in providing interventions and services. It is a dynamic force that often influences client responses to treatment and subsequent outcomes. All right. So to improve the quality of care, ask yourself some of these questions. What populations were included in the research samples used to develop the assessment methods and treatment protocols that you use? Because 9 times out of 10, it's not going to be the population of the client that you have before you. What is the potential for cultural bias in the tools and the treatments or the interventions you're using? Unfortunately, we're in a place where the research is growing. However, we're not quite there yet when it comes to being fully aware of cultural competence and humility, cultural humility. So how do the assessment methods, treatments, or interventions that you're using in your practice address a client's cultural beliefs and practices? These are different things that it's important that you take into consideration when you are working with someone from a diverse population. So we're going to take another look into this cultural competency, just so you can, have these takeaways, because providing cultural competent care requires more than being kind, avoiding microaggressions, or attempting to not oppress someone by your language or your actions in session. It requires that we understand our own clients' beliefs, values, and worldview, and we prioritize them over our own. Even if it may be a situation in which there's a conflict in your culture or in your training or in the background. If there's a conflict, then that's fine. However, that's when you question whether this is going to be a good fit for you or not, and whether this is someone that you may need to move to someone else. So cultural competency is a dynamic, ongoing developmental process that requires a lifelong commitment. Again, it is something that you live. Learn about your own and other cultures. Honor and respect the beliefs, languages, and interpersonal styles and behaviors of your clients. Do what you can to avoid bias and stereotypes. Gain new cultural experiences. So try something new. If you have never been to a synagogue, why not go? If you've never had a certain type of food, why not try it? This will help you to grow in your own level of cultural awareness, and it will help you to not only become a better human being, however, but it helps you to become a better helping professional as well. Practice cultural humility. That is the key aspect, because this is something that we do on a daily basis, trying to practice this humility. Some resources, some amazing TED Talks. Mind you, this is just a few that are out there. Dr. Jessica Deary talks about the challenges and rewards of culturally informed approach to mental health. And then Juliana Mosley, and her actually kind of got me a little teary-eyed. She talks about cultural humility, okay? And there's a number of TED Talks out there and resources when you are trying to learn more about cultural competence. And you want to make these changes within your practice or just simply within yourself. So this is just some of the references in terms of the information in which I was able to gather. And this is now time for questions, if anyone has any questions for me. And I can't see everyone, but if Justin, if you could help me if there are any questions.
Absolutely. You can type in your questions to either the Q&A or into the chat. Can you state the name of the TED Talks again?
Yes. I'll actually go back. There's one by Jessica Deere, D-E-R-E. That one is on challenges and rewards of culturally informed approach to mental health. And then the other one is Juliana Mosley. It's a TED Talk on cultural humility. And actually, if you look into SAMHSA, SAMHSA, they have a lot of trainings as well that they have now included in terms of cultural competence. And providing more information as well into bias and stereotypes that we do want to consider during those times as well. Okay.
Excellent. Um, we have a request. Can you expand on how diagnoses may be affected through different cultures?
Yes. So the biggest aspect there is um, the assessments. So if the assessment is completely thorough, so if you have a client, and this happens often, of course, we have someone that we've been working with for, 4 or 5 sessions, and then they come and there's this whole other dynamic that they drop on you, right? And you're like, okay, well, let me go back and change what we were thinking in terms of this diagnosis. But that original assessment, that original clinical interview when you're first meeting someone, trying to cross over that racial divide, that barrier, and learning as much possible at that time is going to help. And we see a lot of diagnoses that are going to overlap, right? Like PTSD and ADHD are going to have some type of similar symptoms. However, if you've dealt with a child that it is coming in, their parents think that they have ADHD because they can't focus, they're always fidgeting. However, that same child has dealt with some type of significant trauma and or domestic violence, they've witnessed something that has caused this trauma, then we may not be looking at ADHD at all. And we may be looking at some form of acute trauma or PTSD that this child has actually endured. And so that's why the assessment aspect is going to be the biggest component there. And if you are utilizing some tests, we know that, and I was going to include it in here, but it's a whole nother training in itself, the ACEs test, when we're looking at assessing what type of experiences someone has had and how it now contributes to them as an adult, or even if we're talking about children, what level ACEs are they at? Are they at a higher level of ACEs? Because if you find a child that is, high on an ACEs scale, then you're going to have to reevaluate and really look into whether that diagnosis of adjustment disorder is proper, because they may be dealing with something else.
Excellent. We have another question. What may be some signs/red flags that cultural bias is starting to affect your work with a client?
The client themselves. So I would certainly say that. So when we're talking about bias, that's where we're taking that closer look into ourselves, right? We're looking and saying, okay, am I judging this person? Did I have some type of a preconceived notion, before I met this individual? Did I read their intake paperwork and have a whole different picture of who they actually were, right? And so that's when you're really doing that self-reflection. A client is going to, at least in my experience, I would say, you are going to be able to pick up on that signs, if not the direct language, if someone is uncomfortable. Within certain communities, knowing what is culturally appropriate in terms of mannerisms, eye contacts, if we're talking about, someone that comes from a Hispanic family, and we understand that the roles of the men are a little bit different there. If you're dealing with a single mom, there's going to be a different level of things in which she has had to deal with. And so I think taking all of these things into consideration beyond our ABC checklist assessment, these are things that need to be discussed in the clinical interview for a proper diagnosis to take place. So I hope that answered the question, but it basically boils down to the way in which you're aware of your worldview, and how much you are taking into consideration of the person that's before you.
Awesome. I do not see any more questions at this time.
Well, I do just want to say, I thank you for listening. There are, like I said, a number of resources that are available when you are trying to expand in your knowledge of this category. There are a lot of different videos in which you can watch, but in all honesty, the best thing is talking to your colleagues. We learn so much from one another and the experiences in which we have been able to share with our own clients, and dealing with our own possible stereotypes and biases. I want to leave you with another story. Early on in COVID, one of my colleagues that had moved to telehealth, like all of us, were meeting clients for the first time during that time period, right? It's, we're not meeting them in person. We're doing intakes virtually. Well, this particular office did audio calls. Okay, and so my colleague, like myself, had a different name and different dialect. And she had been working with this particular client for a few months. And then there were a couple of racial incidents that took place within the country. And this client comes to their audio session. They have never seen each other, and is blatantly discussing her levels of disgust due to her own racism, not knowing that the therapist on the other end was actually Black. And so this colleague of mine really had to make it through that session and then process exactly what it was she was going to do moving forward. But it was that type of a thing. They had never met. The client had assumed that the therapist wasn't Black, that it was someone else or someone from a different race, and had no idea when she was saying those things how they were being received. And so that's obviously going to be a different type of situation because they've never seen each other. But if you go into your sessions, if you go into each session thinking about that, thinking about the fact that, let me pretend that I cannot see the person in front of me. So I take away my stereotypes, I take away my bias, I take away anything and see this person for who they are and for everything that has made them who they are. Then you have entered a different level of cultural competence and you are learning cultural humility on a daily basis. So I thank you for listening. And I'm open for any more questions if you want to contact me.
Rebekka, I actually just got a phone call with a question for you real quick. Somebody just asked where they can go to find research like you have to continue to educate themselves on this matter.
I can put together a worksheet for you that'll have some of those resources if we want to just send it out.
Excellent. Well, thank you everybody for attending today. Rebekka, thank you so much. I really do mean Rebekka is one of our phenomenal clinicians, is so passionate in this field and wants to provide so many people with so much education. And please join us not next Friday, next month, March 12th, we will do a presentation about trauma in the brain and how that is affected by our lead therapist at our residential treatment center, Andrea De Leon. We look forward to seeing you all there, or at least having you all there. And thank you again so much for your time. We'll be sticking around if anybody has any questions.
Thanks, Justin.